All right, everyone, welcome to today's mini lesson. We're going to do common skin diseases. It's going to be similar to the first time we did it. I have added some topics and some practice questions. Remember to fill out the survey at the end so we can improve and follow your feedback. Shout out to Suspicious Bunch and Pharma Turtles for arranging this. I'm ChicagoDLSinc, offering one-on-one tutoring for the Naplex and MPJE. Tomorrow in the announcements, we'll post the group schedules that are starting next week. And if you're interested, reach out. If you are new today, the save your questions for the end. Happy to answer any and all that you may have. And the resources that I use are RxPrep and Fast Naplex Now. Both are excellent resources. If you're doing questions and you feel like you're not doing well or not prepared for a certain topic, make sure you do research and supplement your information. However, on their own, both are excellent and both are sufficient for passing. So we'll give it a minute for everyone to join. And while we're waiting, if you have taken the NAPLEX or if you've taken an assessment and would like to discuss your score report, I'm happy to do that in direct message. Send me a private message and I will be happy to discuss that with you for free. All right, so let's go ahead and get started. We'll start with drugs that cause discoloration and some background. A pharmacist is expected to know the difference between cancer or medication-caused skin discolorations. So brown, we have encapone, levo, and methyl-dopa. If patient talks about black stool, iron. Red, we have anthracyclines and deferoxarox. Anthracyclines will change the bodily secretions. Deferoxarox will change the urine. Blue, we have methylene blue and mitoxantrone. And then orange yellow, sulfasalazine. Yellow green propofol, flutamide. Brown and yellow, we have nitrofurantoin, metro-ortonidazole, and B2. Red orange, we have azo, and then rifampin and rifapentine. Can anyone tell me the brand name for nitrofurantoin in the chat? Nitrofurantoin in the chat, please, the brand name. And remember that this is a mini lesson, it's not comprehensive. There will be many topics that you have to cover in your preparation, so please make sure that you do a thorough job. If you answered macrobid, that is correct. Excellent. Or macrodantin. Uh, Bobon or Bob on 21 with the 2-point bonus. Great job. Okay, natural products. We have aloe. This is natural from the aloe vera plant. It's used for sunburn and psoriasis. It has a soothing but not a curative effect. Next, we have tea tree oil. This is used for acne, itch, in lotions, and as an adjunct for onychomycosis. It does not eradicate. Lysine is used for cold sores caused by herpes simplex labialis, and biotin B7 is used for hair loss and brittle nails. Last but not least, topical vitamin D is used for diaper rash and psoriasis. On the bottom right, you'll see a picture of a psoriatic lesion. Acne vulgaris, on the top right, there are 5 types of acne. We have blackheads, whiteheads, nodules, papules, and pustules. And the 3 main reasons for acne vulgaris is going to be in androgens and excess, bacteria such as Cutibacterium acnes. And if it's pronounced Cutibacterium, that's up to you. I think Cutibacterium is much cooler. Fatty acids, which is sebum. We classify it as mild, moderate, and severe. In face, the main locations are going to be the face, the chest, the back, and the shoulders. And for some patients, high glycemic diet or dairy can trigger acne. Whiteheads are what we call closed comedones, and blackheads are going to be open. Over-the-counter treatments that are available, benzoyl peroxide, it is effective and it is also available in prescription strength. In prescription strength, it's combined with hydrocortisone, adapalene in the 0.1%, erythromycin, and clindamycin. It can bleach clothing and hair, so be careful. Also, hydrogen peroxide will do that as well. So if you accidentally get blood or you have a cut and you're not supposed to use hydrogen peroxide anyways anymore, um, please note that it will discolor your clothing. So now we have salicylic acid. It's available in washes, medicated pads, and lotions. Azelaic acid available in topical dicarboxylic acid cream in gel form. Prescription retinoids. These are vitamin A derivatives, and their mechanism of action, they reduce adherence of keratinocytes to the oil gland. They are teratogenic. It is bolded, so avoid in pregnancy and breastfeeding in any patient that is trying for a child. Well tolerated with mild skin irritation and photosensitivity. You'll use a pea-sized amount daily at night, 20 minutes after washing your face. Takes 4 to 12 weeks to work. We have oral or topical antibiotics. This is going to be doxycycline or minocycline, clindamycin, and minocycline foam. Isotretinoin is severe nodular acne only, or that's what it's indicated for. 2 forms of birth control, pregnancy, and cholesterol tests are required. REMS, the iPledge registration, is also required, and you only dispense 1 month of isotretinoin at a time. Last but not least, for the prescriptions, you have 15 and 20% azelaic acid in a cream, gel, or lotion form. Now let's talk about cold sores. On the right, you'll see 2 different variations. The left is developing, and on the right, it's going towards the end of its clinical progress with the darker discoloration. The causative agent is herpes simplex labialis. It is common and highly contagious. You can acquire it from active lesions, kissing, saliva, oral, and genital intercourse. The herpes simplex variant 1 virus and variant 1 is the most common but can also be caused by 2. There used to be a clear demarcation of HSV1 was above the waist and HSV2 is below the waist. However, there's no such epidemiological difference anymore. Prodromal symptoms. The patient may complain of tingling, itching, and soreness. Most lesions happen in the same place. Now, you may think that, oh, tingling, itching, soreness are very uh, common or generalized symptoms. However, this is someone who has a previous history of outbreak. And so certain causes of cold sores can be fatigue, stress, sun exposure, acid peels, and dental work. And over the counter, we have Abreva, and we apply 5 times daily at the first site of outbreak until healed. Other options are Zovirax cream, which is acyclovir, Cidovig, which is the acyclovir buccal tablet, and Denavir, which is pencyclovir topical cream. The next topic we're going to talk about is dandruff. On the bottom right, you see a normal scalp. In the middle, you'll see scalp with dandruff. There'll be flaking and itching. And seborrheic dermatitis, which is considered a form of eczema. There'll be visible irritation. There'll be redness from the itching. And the flaking will be more. Scalp is itchy, scaly, white oily flakes, and not just in the hair, but it can be in the shoulders, the back, and the clothing. Can be eczematous or fungal, and can be worsened by hormones, weather, and shampoos. Seborrheic dermatitis will also have peeling of the eyebrows at the nares, which are the sides of the nose, behind the ears, and in the middle of the chest. Over the counter, we have dandruff shampoos with or without ketoconazole, 1%, pyrithione zinc, and there are coal tar shampoos also available. Prescription ketoconazole 2% shampoo. Remember, this can be for some irritating condition, and for some it can cause quite a bit of difficulty. Very good. Next we have alopecia. Alopecia is baldness, and hair thins with age, and that's going to be different. Alopecia is pure hair loss. There are causes, primary causes, some are genetic, and then some are secondary. Hormones is a big cause, pregnancy, childbirth, menopause, and low T. Medical conditions can also cause alopecia, hypothyroidism, alopecia areata. Apologize for the typo, and that's autoimmune. The antibodies target the hair follicles, causing baldness. Lupus can also cause alopecia. And there's also medications that can cause it. Chemotherapeutics, valproate, tacrolimus, and heparin. Hereditary male pattern baldness is the most common. There's also female pattern baldness. Zinc and vitamin D deficiency can also contribute to hair loss. Treatment options are going to be finasteride. Can anyone tell me the brand name for finasteride? Once again in the chat, what is the brand name for finasteride? Also baricitinib, which the brand name is Olumiant. That's used for severe alopecia areata. Okay. So, Proscar is correct. Good. Anyone else have any other brands? Minoxidil, minoxidil topical over the counter, which is Rogaine, is available in 5% foam and 2% or 5% solution. The next topic we're going to do is eczema, and this is an atopic dermatitis. There's inflammation, and it can be related to allergies. Top right, you'll see a patch of eczema, uh, anterior surface of the elbow, and or the cubital fossa. And here we have skin dryness, redness, itchiness, and it can be anywhere, cheeks, arms, and legs. If it is allergic, it can be associated with other allergies and asthma. We reduce the symptoms with topical corticosteroids, and depending on mild, moderate, or severe. Mild, we're going to do a low potency, so desinide 0.05% or hydrocortisone 2.5%. For moderate disease, we'll do triamcinolone 0.1%, fluocinolone, or betamethasone. Second line treatments are going to be the topical calcineurin inhibitors, so Elidel, 1% cream, applied twice a day for 2 years or older. There is a potential risk for cancer. Tacrolimus is protopic, and that's 0.03% or 0.1% ointment, is also a second line option. PDE4 inhibitor, crisaborole or Eucrisa, is a 2% ointment, and that's BID greater 2 years of age or older. Dupixent is another one. It is sub-Q, and it is an IL-4 receptor alpha antagonist. Uh, avoid live vaccines if a patient is on Dupixent, and then refrigerate. Prior to use, we bring it to room temperature for 45 minutes. All right. Moving right along, this is definitely a new addition, psoriasis. It is a not common, autoimmune condition, and it results in the overproduction of skin cells. The silvery white scales are going to be the dead cell buildup. They can become inflamed and red, causing serious itching. They are a thick patch, and if you try to remove it, they'll be bleeding underneath. Methotrexate has traditionally been first line, and to reduce any side effects, we suggest folic acid 1 mg per day. Okay. Now on the top right, you'll see a picture with several different kinds. Actually, if we go back, on the left, on the hand, that's plaque psoriasis, and on the right, that's going to be psoriasis of the scalp. So top right, we have a picture with plaque, guttate, pustular, scalp, nail, and psoriatic erythroderma, different types. And we classify them mild, moderate, severe psoriasis. So I have some names and brand names. Topical is going to be betamethasone. There's also a spray. Vitamin D analogs, topical retinoids. And then if it's severe psoriasis, we'll try phototherapy and biologics. So methotrexate, cyclosporin, acitretin, and anthralin. Anti-TNF agents are another class of drugs. PDE4 inhibitors, uh, anti-IL-12 or 23 antibody. That's going to be the Stelara, that's a sub-Q. Uh, Tremfya, Ilumya, and Skyrizi are interleukin 23 blockers. And then anti-IL-17A monoclonal antibodies are going to be Cosentyx, Taltz, and Cilic. And all of those are sub-Q. With Cilic, there is a suicide warning. Okay. For Cilic, remember S for Cilic, S for suicide, and that will help you with those warnings. Good. Our next topic is going to be diaper rash, and it's very common in infants, toddlers, and disabled adults. So remember the spectrum of age, both the young and the old. Um, I left off elderly, but remember that. Due to friction and contact with urine and stool, the skin barrier is broken and bacteria or yeast overgrowth can occur. On the right side, you'll see a picture of a cute child, and then mild, moderate, and severe. So prevention is key. Change diapers often. Do not cover with plastic. Wipe well with unscented wipes or plain water, and let air dry when possible. Petrolatum ointments with or without zinc oxide are skin protectants. If it's caused by yeast, we can treat with nystatin, clotrimazole, or miconazole. Hydrocortisone 0.5 or 1% can be applied BID for a few days if there's a lot of inflammation. And if there's mixed infections, and also if it's getting worse or not getting better, refer to pediatrics for a checkup. Mixed infections are common. Now, some steroids that are used in the treatment of skin conditions, fluocinolone, and it's for psoriasis of scalp. If it's for the Derma Smooth, it's massage oil into scalp and leave on for 4 hours, then rinse. For inflammatory dermatosis, there's also an ointment or a cream. Fluocinolone is going to be for flack type psoriasis. Topicort is available in a cream, ointment, gel, and spray. Clobetasol is the most powerful steroid. Where there's a warning, where do you not use clobetasol under any circumstance? There's two areas of the body. If you can put that in the chat for me. if you're familiar. Once again, clobetasol, where do we not apply that? Uh, then there's a Luxic foam, Kenalog, and a few others. Now, if you're new and you're unsure of the questions that I'm asking, that's okay. Please make a note. Go back and review after we completed the session, either today or tomorrow. And after you've reviewed it, it will greatly help your retention. Greatly help your retention. Very good. So I have a couple answers. Head and genital area. Yes, that is correct. Very, very good. Sometimes they'll say perineum instead of genital area, but yes, that is correct. Very good. So now we're at the practice questions. I believe I have 6 of them. If you're new, what I do is I'll read the question, and at the end, please put your answers in the chat. If you're not sure, you can put a question mark by it, or you can guess. If you're unfamiliar with the information or the topic, or you're not sure, please make a note to go back and review it. I will go over each question individually. All right. So the first is going to be, which of the following is not a common physiological complication in the aging of an elderly patient? Select all that apply. Now, both RX Prep, Past Naplex Now, and the actual Naplex do a great job with not, there are no patterns. One of them can be correct, all of them can be correct, or any number in between. Please make sure that you are aware of that and evaluate each answer choice. So A is going to be skin thickening, increasing the risk of skin and soft tissue infections. Choice B, slow GI tract and possible reduced absorption of some vitamins and minerals like B12 and iron. Choice C, a drop in GFR, which can contribute to the accumulation of many medications. Choice D, increased concentration of albumin due to the loss of intravascular fluid and dehydration. Choice E, loss of muscle mass, reduced physical conditioning. All right, I have 4 answers. Does anyone else want to try? All right, very good. So the correct answers are going to be A and D. And let's talk about why. Skin thinning increases the risk of infections. So therefore, A is incorrect as written. Next is albumin actually lowers, and this may be due to dietary changes, and this can increase the free fraction of many drugs such as warfarin. So choice D is incorrect as written. However, choice B, choice C, and choice E are all correct as written. So if you chose A or D or both, good job. Does anyone have any questions or concerns for practice question 1? All right, if you think of one later, feel free to type it into the chat. Also opening up the floor to questions from the presentation. If it's not enough presentation, you can also ask. Now, practice question 2. A 66-year-old female was recently started on Lamictal. What is an important educational point that this patient should look out for? Choice A, the medication can cause discoloration of the urine. Choice B, immediately report any sign of rash to provider. Choice C, the medication should not be taken with Tylenol. And choice D, the medication can cause muscle soreness. Give everyone a chance to respond. Okay, so the correct answer is going to be B as in Brilinta. So lamotrigine can cause severe skin rashes that can require hospitalization. And so this lead if a patient complains of a rash, you need to immediately discontinue treatment. So most cases of life-threatening rashes occur within 2 to 8 weeks of starting treatment. However, there are isolated cases with long-term treatment. So this should be counseled to all patients taking lamotrigine, and that is very, very important. Good. Now you may be asking why I quiz branded generics, knowing the top 300 is very, very high yield and very important for the Naplex. In the resources guide, there are excellent links. Memorizing or trying to learn 300 in one day is very, very difficult. So try to break it up and do 10 or 20 a day. That number is arbitrary. Do what works for you. All right. Any questions or concerns for practice question 2? All right. Moving right along to practice question 3. And I believe there are 6 total. 44-year-old male was recently diagnosed with mild, non-purulent cellulitis. Which of the following is the most appropriate empiric therapy? Choice A, vancomycin. Choice B, dicloxacillin. Choice C, ceftriaxone. Choice D, piperacillin tazobactam. Okay, so this one might be a little tougher. I know ID is a difficult topic. The correct answer is choice B, dicloxacillin. Mild, non-purulent cases of cellulitis, you would want to do an oral antibiotic that is methicillin sensitive, and so that would be dicloxacillin. Choice A and choice D are not indicated in overkill, and choice C would also be would not be indicated in this case. So choice B, dicloxacillin. Okay. Can anyone tell me a brand name for choice C? Ceftriaxone, what is a brand name? Put that into the chat. All right, good. Rocephin is correct. Now let's look at practice question 4. 17-year-old girl experiences a severe flare of acne. She has not responded to topical benzoyl peroxide wash and oral minocycline. You are concerned about scarring potential and decide to start her on isotretinoin. You counsel her on the side effects of isotretinoin. Which of the following is not a side effect? Choice A is depression. Choice B is headache and blurred vision. Choice C is hyperpigmentation. Choice D, photosensitivity. And choice E is teratogenicity. All right. So the correct answer here is going to be choice C, hyperpigmentation. Uh, teratogenicity is a side effect or an adverse effect. Mood changes, so choice A is also a side effect. Pseudotumor cerebri, or which presents as headache and blurred vision, is also, and photosensitivity. So choice A, B, D, and E are all correct as written. Choice C is not a side effect. So if you chose C, great job. If you are unsure, definitely go back and review isotretinoin. It's very high yield. Okay, good. So let's go to practice question 5. I know I am not asking, but if you do have any questions or concerns, feel free to type them into the chat. All right, practice question 5 is a little more wordy. It is a select all that apply. So, which of the following statements are correct counseling points for CS's chemotherapy? Select all that apply. So, 61-year-old male, hospitalized a few days ago, and it was found the patient has B-cell non-Hodgkin's lymphoma. The patient is going to be put on R-CHOP therapy consisting of rituximab, doxorubicin, vincristine, cyclophosphamide, and prednisone. This patient has a past medical history of hyperlipidemia and hypertension. The patient requires counseling of his new chemotherapy regimen prior to administration. So, the allergies are going to be codeine. Lab sodium is 138, BP is 115 over 75, heart rate is 80, serum creatinine is zero point 0.9 mg per deciliter, potassium is going to be 4.3, corrected calcium is 8.9, magnesium is 1.9. Medications are listed. Choice A, doxorubicin has a potential to turn bodily excretions such as urine, sweat, and tears a red color. Choice B, cyclophosphamide may cause hemorrhagic cystitis, which can be exhibited as painful urination and bloody urine. Choice C, vincristine may cause heart failure in cumulative doses. Therefore, an echocardiogram will be done at baseline and periodically. Choice D, rituximab can often cause extravasation reactions, such as swelling, pain, and burning at the site of injection. And choice E, the first rituximab infusion is typically given over a longer period of time to decrease the risk of a serious infusion reaction. So please remember that this is a select all that apply. And this practice question 5 touches areas 2 and 3. Area 2 is identify drug characteristics, and area 3 is develop or manage treatment plans. Okay, Has everyone answered who wanted to answer? So the correct answers here are going to be A as in Adriamycin, B as in Brilinta, and E as in excellent or Excedrin. So let's talk about why. A is correct because doxorubicin does. It is correct as written. Bodily excretions can turn into a red color. Other drugs that change bodily fluids into a red color would be rifampin and pyridium, aka azo. Choice B is correct as written because cyclophosphamide and the other drug in this class, ifosfamide, can also cause hemorrhagic cystitis. The symptoms are painful and bloody urination. Prevention is going to be through mesna. It's a compound that binds to acrolein, which is the active metabolite of cyclophosphamide. Patients should receive adequate fluid intake as well to help prevent hemorrhagic cystitis. So B is correct. Now C is incorrect because vincristine does not cause cardiomyopathy. That's going to be doxorubicin. Cumulative doses of 550 mg per meter squared and higher have the highest risk. So for doxo, we would do an echo. Vincristine has neuromuscular side effects such as peripheral neuropathy, and it should never be given intrathecally as this can be fatal or at the minimum cause painful ascending paralysis. Remember, any intrathecal injections have to be preservative free. They will have PF on the label, preservative free. Now, choice D is incorrect because rituximab does not cause extravasation. Doxorubicin and vincristine do have a risk, and they are both vesicants. So that will be painful. Choice E is correct because it does have a risk of serious and fatal infusion reactions, mostly associated with the first infusion. So if you looked at the medication list, Tylenol, diphenhydramine, these are given uh, prior to rituximab therapy to lessen infusion reactions. Good. Good job, those of you that attempted this question. Now let's go to practice question 6. Which of the following are true regarding methotrexate or MTX? Select all that apply. Choice A is going to be methotrexate reversibly binds to and inhibits dihydrofolate reductase. Choice B, it may be administered orally, IM, IV, intrathecally, or sub-Q. Choice C, brand names include Otrexup, Rasuvo, Reditrex, Trexol, Exapmap, and Xgeva. Choice D, adverse reactions include alopecia, SJS, and GI intolerance. And choice E, doses greater than 500 mg per meter squared require leucovorin rescue. This is going to be an area 2 question. We are identifying drug characteristics. Okay. Did anyone else want to guess or put their choices in? Very good. So the correct answers for this one are going to be B, D, and E. So let's talk about why. B, these are all the forms of administration. Remember that rheumatoid arthritis, it is dosed orally weekly, but misfills commonly occur and the dose is given daily. So please be very careful with that. Choice C is incorrect because Xgeva is a brand name for denosumab. And I'm going to type that into the chat. Xgeva is. So it's a trick. You have to be careful and evaluate. They get you with the first ones, and you're like, of course, the last one would be as well. Why would they give you six names and one of them wrong? Please be careful when you evaluate the brand names and generics. Also, choice D, the reason it is correct, methotrexate has a large range of side effects, and some of them are going to be dose or route specific. So SJS, GI intolerance, and alopecia are all correct. Others may be headache, photosensitivity, stomatitis, and blood dyscrasias. Very, very good. Choice E, if you chose it. This is correct. Leucovorin rescue therapy, 24 to 36 hours after the methotrexate dose is required. These doses can be fatal, and so leucovorin is used to bypass the metabolic block induced by methotrexate. All right, choice A doesn't reversibly bind to and inhibit dihydrofolate reductase. It irreversibly binds. So several of you guessed or chose A, but they wrote reversibly in the question, and it's supposed to be irreversibly. So paying attention to detail is important. You are being tested on what a entry-level pharmacist is supposed to know. And so knowing the difference between reversibly and irreversibly binding and inhibition is very, very important. All right. So that is the last practice question for today. Does anyone have any questions or concerns about the session or the practice questions that we've done? If you have any questions about the Naplex or the MPJE, you can always send me a DM as well. All right. You're welcome, everyone. Happy to be here. Tomorrow we'll post the schedule for next week's mini lessons and the group sessions that are starting.